valuable treasure, always appreciate, nurture, and protect it.
Hey there, welcome to my channel. I'm thrilled to have you join us today. Before we jump into today's topic, let me ask you something. Have you ever heard about hemorrhoids? If you haven't, don't worry. Stick around, because we're about to dive deep into what they're all about. So what are hemorrhoids? Simply put, they're swollen veins in the lowest part of your rectum and anus. Now, what causes them? Straining during bowel movements, sitting for long periods, or being overweight are common culprits. Diagnosing hemorrhoids typically involves a physical examination by a healthcare professional. And what signs and symptoms should you look out for? Well, bleeding during bowel movements, itching or irritation around the anus, and even pain or discomfort. But let's debunk some common myths and misconceptions. One myth is that hemorrhoids are caused by sitting on cold surfaces. Not true. Hemorrhoids are actually caused by increased pressure on the pelvic and rectal veins. Lastly, let's discuss treatment options. From over-the-counter creams to surgical procedures, there are various ways to alleviate hemorrhoid symptoms and promote healing. Let's begin with non-surgical treatment. 1. Topical creams and ointments. Over-the-counter creams containing hydrocortisone or witch hazel can help relieve itching, inflammation, and discomfort associated with hemorrhoids. 2. Sitz baths. Soaking the anal area in warm water for 10 to 15 minutes several times a day can provide relief from pain and discomfort. 3. High-fiber diet. Eating foods rich in fiber, such as fruits, vegetables, whole grains, and legumes, can soften stool and make bowel movements easier, reducing strain on hemorrhoids. 4. Hydration. Drinking plenty of water throughout the day helps prevent constipation and promotes softer stools, which can ease symptoms of hemorrhoids. 5. Stool softeners. Over-the-counter stool softeners can help prevent straining during bowel movements, reducing pressure on hemorrhoids. 6. Medicated wipes. Pre-moistened wipes containing witch hazel or aloe vera can soothe the anal area and reduce irritation. 7. Rubber band ligation. In this procedure, a rubber band is placed around the base of the hemorrhoid to cut off its blood supply, causing it to shrink and fall off within a few days. 8. Sclerotherapy. A chemical solution is injected into the hemorrhoid, causing it to shrink and eventually disappear. 9. Infrared coagulation. Infrared light is used to coagulate the blood vessels supplying the hemorrhoid, leading to its shrinkage and resolution. Now, to surgical procedures. Here are all the surgical interventions commonly used in the treatment of hemorrhoids. 1. Hemorrhoid SPY. This surgical procedure involves the removal of hemorrhoidal tissue. It is typically recommended for severe cases of hemorrhoids or when other treatments have failed to provide relief. During a hemorrhoidectomy, the surgeon may remove internal or external hemorrhoids or both. The procedure is usually performed under general or regional anesthesia. 2. Hemorrhoidopexy. Stapled hemorrhoidopexy or PPH. In this procedure, also known as stapled hemorrhoidectomy or procedure for prolapse in hemorrhoids PPH, a special stapling device is used to remove excess tissue and reposition the remaining hemorrhoidal tissue back into its normal position. This procedure is less painful and has a faster recovery time compared to traditional hemorrhoidectomy. 3. Hemorrhoidal artery ligation. HAL is a minimally invasive procedure that targets the blood vessels supplying the hemorrhoids. Using a Doppler ultrasound probe, the surgeon identifies the arteries feeding the hemorrhoids and ties them off, reducing blood flow to the hemorrhoidal tissue. This causes the hemorrhoids to shrink over time. 4. Transanal hemorrhoidal dearterialization. THD. Similar to HAL, THD targets the blood vessels supplying the hemorrhoids. However, instead of tying off the arteries, the surgeon uses a specialized device to suture and ligate them. This procedure is performed through the anal canal and is associated with minimal pain and a shorter recovery period. 5. Laser hemorrhoidectomy. In laser hemorrhoidectomy, a laser is used to remove hemorrhoidal tissue. This technique offers precise tissue removal and may result in less pain and faster healing compared to traditional surgical methods. 6. Radiofrequency hemorrhoidectomy. This procedure uses radiofrequency energy to coagulate and remove hemorrhoidal tissue. It is a minimally invasive technique that may result in less postoperative pain and a quicker recovery time compared to traditional hemorrhoidectomy. Well, that wraps up our discussion on hemorrhoids. If you found this information helpful, be sure to subscribe to Health Harmony Hub and hit that notification bell to stay updated on our latest videos. Thanks for watching, and I'll see you in my next video.